12 now, evidence synthesis. And we're starting with evidence-based veterinary medicine, or EBVM. Here's the thing I want to correct up front, because it's a common misconception. EBVM is not just do what the studies say. It rests on three pillars, and all three carry weight. Best available research evidence, your own clinical expertise, and client and patient values. Integrated decision-making means all three come to the table. A study can tell you what happens on average in a population. It can't tell you what's right for the animal in front of you, with this owner and these constraints. The evidence hierarchy is worth memorizing in order. Systematic reviews and meta-analyses sit at the top, then randomized controlled trials, then cohort studies, then case control, then cross-sectional, and at the bottom, case series and expert opinion. As you move down that ladder, susceptibility to bias and confounding goes up. And note where expert opinion lands, at the bottom. That's humbling and it's deliberate. Confidence is not evidence. PICO is your tool for turning a vague clinical question into an answerable one. Patient population, intervention, comparison, outcome. Should I use this drug is not searchable. In adult dogs with this condition, does drug A compared to drug B reduce recurrence at 12 months? That you can actually go find an answer to. And PICO isn't just for literature searches. It's the skeleton of a good research question too. Then the two validities, which get mixed up constantly. Internal validity asks, did this study actually measure what it claims to measure within its own sample? Was it well designed, free of major bias and confounding? External validity, generalizability, asks a different question. Can I apply these results to my patients in my setting? Does the study population resemble the animals I actually see? And here's the relationship between them. Internal validity comes first. A study with poor internal validity is not generalizable to anyone because its results aren't trustworthy in the first place. But strong internal validity doesn't guarantee external validity. A beautifully conducted trial in research beagles under controlled conditions may tell you very little about a working farm dog. Finally, number needed to treat and number needed to harm. Numbers that translate statistics into something you can say out loud to a client. Number needed to treat is 1 divided by the absolute risk reduction. How many animals you have to treat to get one additional good outcome. Number needed to harm is 1 divided by the absolute risk increase. How many treated before you cause one additional harm. A small number needed to treat is good. A large number needed to harm is good, and putting them side by side is one of the clearest ways to have an honest conversation about whether a treatment is worth it. If this helped, like, subscribe, and share for more.